wedge and just see what's going on here, okay? Make sure that he's numb. Remember, we're not going in sideways. We're going on a 10 or 15 degree angle. So what I'm going to do is this, go right in there and just put a little movement. I know he's feeling something there. Is that pain or just pressure, Mike? A little of both? Okay, so let's go ahead and numb him up a little more. Can I get some more anesthetic, please? Lidocaine, one of the assistants. So while they're getting that, I'm just going to try one of the other teeth just to make sure. So we're going to go right here in this area and do the same thing. Notice I'm not horizontal. I'm on a 10 degree angle, and I'm just going to rotate a little bit. So same thing, Mike. Here we go. This one's better, yes? Okay. So you see that's what we're doing. We're going to go over here on the premolar, do the same thing, and just a little rotation. Make sure it's just pressure that he's feeling. And then we're going to do the same thing here, and just make sure that's just pressure. Okay? Thank you. So it looks like it was around 6, which has the longest root, that he's feeling a little bit of discomfort. So we're just going to go. Thank you. So a little higher up is going to get you numb right under the nose and under the eye.
What kind of anesthesia have you already given?
I've already given them 2 Lido and 1 Marcaine.
Infiltrations and palatal?
Infiltration and palatal, yes. Yes. Okay, so now we know that the teeth are pretty numb. So you can go with a curette or a molt or something and just sever the PEL like we were talking about. So I'm just going to let Mike know. I'm just going to keep moving unless he raises his left hand to let me know, hey, Doc, I'm feeling this is uncomfortable, okay? Thank you. We're just going to go here. Can you fix that light, please? So if you look, I'm not reflecting a full flat, but I'm just severing the PEL all the way around, okay? Kurt, you just keep me posted if I'm off camera, okay? All right, so everything looks good, so now we're really gonna crank here. So what I'm gonna do is go on that angle, like we talked about, and just sort of rotate. Here we go. Little pressure. Good job. So if you look, I just sort of turn that, and then we're going to turn the other direction. Then I'm going to go on the next tooth. So you could probably see already with the wedge, I actually can get a little bit of movement of that. That's why you're sort of feeling some of that movement. Now there's nothing else to go here. So now we're going to go right in this area and go the opposite direction. Okay? Same here. And you can already see that tooth is getting loose, right? And then let's just go around this tooth. Remember, we want the enzymes to build up as much as possible. He just needs a saliva ejector back there, please. I know he's sort of tall, you can't see back there. Okay. Now, if you wanted to, instead of the wedge, we have the luxator. So let's just pretend we didn't have the wedge and we're using the luxator. So that goes in here. Same type of thing, okay? Also here. All right, so now we're gonna go to our physics forceps. This usually has a green bumper. They just made these for the demo in yellow, but normally they're green, okay? So the way we're gonna position this is we're gonna take this, we're gonna position the beak and get a solid purchase point. So if you take a look at the angle, this would be off angle, this would be off angle. If you look right there, it's the long axis of the tooth. Everybody sees that, yes? Notice, I'm not squeezing hard. If you look at my grip, bring the bumper up as high up as possible, and now I'm just gonna rotate 10 degrees. If you look in the video, you can see the tooth has already moved, okay? We're gonna go another 5 degree, and you can see the tooth has moved way to the facial. We're not gonna keep going. I'm gonna stop. I'm gonna grab my 150, We're going to put it on the tooth. Now, what we'll do is just rotate. I don't want to go buccolingual and break the buccal plate. We can just rotate, and you see the tooth is out. Now, the canine may be a little bit of a different story. So let's go ahead and do the same thing for the central, because that's going to be the next easier one to get out. So far, so good, Mike? Mm-hmm. Thank you. So we're going to position that. You always want to make sure the beak is on solid tooth. And if you take a look, his vestibular area is very shallow here. So the fulcrum is not as ideal as we would like. So we're just going to be a little patient getting that tooth out. We're going to follow the long axis of the tooth. If you look, it looks straight right there. I'm going to look at my assistant and say, how is this looking from her angle? And it's following the long axis. So we're going to do the same thing and let Mike know there's going to be a little bit of pressure. We go about 10 degrees and just hold it like this. And now I'm going to go the other 5 and put a little more pressure. Now I'll almost feel like a little expansion of the bone, and sometimes you'll feel a little pop. If you want to see, you'll see the tension start to build up, and then this tooth, you see, all of a sudden move. So we're going to go like this and do our rotation. And here you see the tooth. So now I have the upper right forceps, upper right. So if you take a look, it's angled a little bit more. We want to make sure it's following the long axis of the tooth. Right there. If ever there's a convexity where it keeps slipping, like it just slipped for a second, but if it keeps happening, I would just go ahead and take the burr and flatten it out, okay? But right now it's stable. So we're going to do the same type of thing. And everybody saw how quick that went. So now we're just going to go. And you can see no bone on that one. Okay? Let's go to the molar now. I'm just going to stretch him a little bit to get back there. And remember, there's a lot of decay in this tooth, so this one may fracture off. If it does, not the end of the world. We know that there's 3 roots, but we're going to try the physics forceps to see first, can we get it out with the physics? If we can't, then we'll section and get it out in pieces. So we're just going to go ahead and do the same type of thing and let the pressure build up. So I have it at about 10-15 degrees. I'll maybe just go a few more degrees to see if we can get movement. There, everybody see that? Oh no, you can't see. Can you hold his lip down a little bit there? Right there. Here, let's use the mirror. Just like that.
Is that better?
Let's see if you turn this way, Mike. No. Anyway, I saw the movement. You'll see it here in a second as it comes out. There it is. Okay, so you do not need to use brute force with these. It's all sort of in the technique. Notice, I just loosened it with that. I didn't take it out with the physics. Okay, so you can see what he's got here. You can see sort of some granulation tissue, a little bit of bone. But look at the size of those roots, okay? All right, now we're back to the canine. So we're gonna go to our anterior forceps. And now it should be a little looser. So we're gonna do the same thing. Notice I don't have a death grip on this. I'm just gonna leverage this. And we're just gonna go another 5 degrees to see if we can loosen it a little more. Let that tension build up. See the movement there a little bit? There we go. I felt it. So now I'm just gonna grab it with this forceps. And again, what I like to do is not go buccolingual. Press almost apical and rotate. Just slip in there. So if you notice, the bone is connected to the gum, so we want to detach that. And you saw, I barely went to the buccal, but when people have an undercut like that, it's not uncommon to see that happen. So we want to separate this and not pull that off with the tooth and tear the gum, right? Good. Go ahead and remove that. So you can actually see the size of that and why, because of that undercut, that facial plate came out. Not a big deal. Okay? So now we're going to go ahead and curette. Hold on. This is why I don't like the outer gates. Mike, so all the teeth are out, buddy, okay? Go ahead and pull it just a little bit. There you go. Go ahead and suction in there, please. Okay, so we're going to go ahead and curette real quick.
It's right here on his.
Ah, thank you. Okay, we're going to go ahead and irrigate. And then let's just try some of the different materials here.
Oh, it's coming off again.
Maybe just keep it out. I don't know.
Okay, so we talked about it yesterday. You're going to use one sheet at a time. Roll it before it gets too wet. And then we're just going to pack that in there. Same with the other. For this one, let's go with the Osteogen because it's just a bigger void. I'm just going to shape it like a canine. See if we can get it in. I may have to slenderize it a bit. Nice. Okay, so what we're going to do is go ahead and suture this to control that area. Good. And right here there's a sharp kind of bone, so we want to smooth that out so later when he gets a denture, he doesn't feel that sharpness there. So the best test is just go with your finger and feel where that sharpness is. There we go, much better. Okay. If you want to just blot that for me, please, I'm going to stitch. Any questions so far? I do need a scissor, somebody. There's no scissor here in this pack.
Grab a scissor.
Somebody want to get a scissor, please? Okay, so we're going to start here. Remember, we're going from the inside out. What I'm going to have you do is use your mirror, not your finger. Use the mirror. Yeah. I know you trust me, but. Okay. Let me see that scissor. This is too long. So you want to retract the area, yeah. Good. Just cut this tail. 2 millimeter. Here. And then just block that.